Medical imaging, when it comes to cancer patients, mostly we help with CT scan. And when it comes, we talk about CT scan, we do it in two parts. One is the diagnostic, and then the other one is for planning purposes. When they are planning therapy for the patient, they need CT scan. So how the diagnostic comes in is, for example, for newly diagnosed patients, we have to do staging where the doctors have to evaluate using CT scan how far the cancer has spread, whether they are mates, like it has spread to other parts or there's just a primary one. And then we also do follow-ups, what we call restaging, where the patient has been treated, maybe with therapy, radiation therapy or chemotherapy, and then they come to see the progression of the disease, or to see, even for those who've been cleared after treatment, to see whether there is reoccurrence, and then the oncologist will take it up from there. Then when it comes to planning now, when the patient, before the patient goes for radiation therapy, for example, we have to come and plan here, do a CT scan for planning, so that they can do the same setup that we do here, they can go and do it there. For example, patients that have to be treated on the head, we have to make sure they are immobilized the same way they will be immobilized there. So we do things like a mask for them, and then we scan. And the field that we are going to scan, they have to use it for them to focus their treatment on that same area. So they have to see the area first before they put the patient on the treatment machine, so that they can just focus on that area that they are treating. So when it comes to limiting the side effects of radiation, it's like any other normal CT scan. The radiologists make sure they plan it in such a way that the dose that the patients take is not that is going to give them, side effects. There are people, we give contrast medium that has got iodine in it, and there are people who are allergic to that. But we make sure before we inject contrast medium into a patient, we make sure they are not allergic. And if they are allergic, we make sure we give them pre-med that will stop the reaction, that will cause the patient not to react. So the risks are quite minimal because we follow procedures to avoid anything that will harm the patient. Okay, so the results is actually done the same day. So it's a matter of hours, and sometimes even minutes. It depends on how our radiologists are busy. Within a day, most of them come in the morning, we scan, and they've got an appointment in the afternoon to follow up on the scan. So the same day they get the results. When it comes to financing the procedures done at Oncology Center, most of them have got medical aid, and those that don't have get funding from the state. And the state is doing quite a great job when it comes to funding, because they fund them 100%, especially those who are on government medical aid. The state takes up that burden from the patients. The planning CTs, most of them, the charges are quite minimal. But the diagnostic is the normal charges that every other person encounters when they come for CT scan, which is also quite minimal. Most of them are funded, but the private ones are given a certain percentage discount from medical imaging point of view. They shouldn't be afraid of this department. They shouldn't be anxious at all. We are here to answer all their questions, and also to just calm them down. We chat, we walk them through the whole procedure, and they become our friends. We share the burden of their journey and all that. And we are actually happy when we see them fighting cancer and defeat it at the end of the day. So we get quite excited when we see a patient coming for follow-up and they are doing so well. Yeah, that just fulfills us.